A critical care bed alert really means that we are down to our last one or two beds, often one bed, which we try to reserve for an in-house crash for someone who's already with us who might require transfer to the ICU. And critical care units, particularly units at places as acute as Toronto General Hospital, very highly skilled colleagues who work in that environment. And really we're saying we don't have additional capacity, either physical or in this case, staffing capacity, to take more activity at this point. In a way, a critical care bed alert allows us to say we will have the staff or we will find an alternate place for the patient. What I think we're all worried about now is we're coming perilously close to not having a lot of alternate places. In years past, we have seen very sick people have to be transported out of the country. That isn't where we hope to go. And obviously, we're all working at how do we make sure that we have these unique skills, particularly in ICUs, but across the system, to meet the needs of Ontarians and Canadians. Interestingly, this is not unique to Ontario or UHN. This is an international challenge, talking with my colleagues in the United Kingdom and the United States, all facing very similar challenges. It's not sustainable. I think there is no solution other than to grow the complement of skilled workers. And in addition to that, look at how we extend other scopes of practice of other providers. So we know around the world we have varying scopes of practice, things that only doctors do here, perhaps nurse practitioners are able to do elsewhere, things that only nurses do here, technicians might do elsewhere. And to be frank, we just don't have the size or complement of universities and colleges to train the number of people we need in the time frame we need. So we really have to look at, one, maxing out enrollment, two, looking at all of those up to 26,000 we hear quoted nurses who were foreign trained graduates. How would we, with the college, safely approve them to get into the workforce? And then, of course, monitor and supervise them to ensure that their scope of practice and that their skills are up to the Canadian standard. Last but certainly not least, I think we can't have this discussion without worrying about the well-being of caregivers, caring for the caregivers who have expressed very clearly they are under intense stress and simply can't do more work.